Zambia Blog Talk Radio.
Are you ready to start your own show? Look no further than Zambia Blog Talk Radio TV's unbeatable hosting packages. We have hosting packages for all your live streaming needs. Introducing our basic, standard, and premium plans designed to fit your show's unique needs. With our basic plan, you get hosting and streaming only to Zambia Blog Talk Radio TV platforms, technical support, and a full hour of captivating content. Choose our standard plan, and you'll not only enjoy everything in the basic plan, but also receive promotions on our Facebook page and the freedom to stream to your personal platform, Facebook or YouTube. Your show, your choice. And for those who demand the best, our premium plan offers all the benefits of the basic and standard plans, plus the ability to multi-stream to your preferred platforms. That's right, the spotlight's on you. But wait, there's more. Are you planning an unforgettable event? Our events package is your ticket to flawless live streaming. From weddings to conferences, we make every moment count. Ready to shine on Zambia Blog Talk Radio TV. Reach out to us today at zbtr2009@gmail.com for questions, inquiries, or to create a custom one-time show package. Remember, at Zambia Blog Talk Radio TV, your success is our mission. All fees are subject to periodic review and change, ensuring you always get the best value. So, what are you waiting for? Let's make your show a sensation only on Zambia Blog Talk Radio TV. Zambia Blog Talk Radio TV, where vision comes to life. Follow our Facebook page at www.facebook.com/Zambia Blog Radio or visit our website at www.zbtr2009.wixsite.com/ZBTR TV. Don't miss this opportunity to shine on ZBTR TV, where your vision comes to life.
Hi everyone, welcome to the show. It is Saturday, December the 16th. Merry Christmas, Happy Holidays. Like we say in Zambia, compliments of the season, and welcome to the show. Please tell a friend that we are here on ZBTR and we continue our conversation that we started 2 weeks ago with my dear brother here joining me, Pastor A.C. Mulenga in Florida. Alan, good morning. Good morning.
Good morning.
Good morning. The season, or I don't know which one you prefer. Happy holidays, Merry Christmas. Which one do you play?
I'm a full-time Merry Christmas. They're trying to steal Christmas away from us.
Okay. Well, Merry Christmas to you and the family. Welcome.
Thank you.
Yes.
Looking forward to today.
Yeah, looking forward to today. We want to let everybody know before we introduce our guest, and she's going to lead us into this discussion and answer all your major questions, that today we are here until we exhaust every question, every issue, humanly speaking, and we are going to talk, discuss, and I have an announcement to make. This is very interesting, okay? We have a feature where people can call in. Yeah? So we're going to see how that is going to work, although it's not fully polished or cleaned up, but at least some people will be able to call in and will be able to join us. All right, ready to go, Alan?
Yes, we are. We're ready to go.
All right, let's bring in Miss Mutinta. Good morning. How is Florida today? Merry Christmas to you. Or is it happy holidays or compliments of the season?
It's compliment. We'll go with compliments of the season at this point, right? It's quite gloomy in Florida, actually.
Yes.
Pastor Alan, we are just 7 minutes away from each other. I'm sure it's drizzling over there as well.
Yes, it is. It's pretty gloomy.
Yeah, absolutely.
Excellent. All right. And would you like to introduce our guest here? They will join us at a certain point, but we can still welcome them instead of them sitting in the back.
Hi, Taylor.
Hi.
Taylor. Go ahead and introduce yourself. Thank you for being here.
Hi. Thank you for having me. My name's Taylor Ripper. I love Mutinta. She's amazing. She's my teacher, and she has helped me a lot. I have a diagnosis of schizoaffective disorder, so I'm excited to share my story and talk about grief and the things I've gone through today.
Okay, excellent. All right, Taylor will join us at some point where she's going to talk about her life extensively. Okay, Pastor Alan, let's begin the conversation today. Last time we were here, we what do they say in English? We opened the we touched we went into things that touched a lot of people's lives, and everybody joining us, please share the link. We are on ZBTR TV on YouTube and Zambia Blog Talk Radio on Facebook. Just tell a friend that the show is on and they can join us. We are not going anywhere today until we address whatever needs to be addressed. Miss Mutinta has given us our fullest attention and time today. All right, so this is it. Pastor Alan, go ahead.
Well, last week opened up so many. There's so many different directions that we could go with this. Also, like personal life. That's the life of it. When you're a leader, sometimes you yourself are hurting, but you still gotta attend to people and lead people. So some of it is personal, some of it is tools that we can use. So it's really, really great. But I guess we can start with maybe Mutinta, you helping us to understand the difference between psychiatric providers or psychiatric providers that take the nursing route, and then and also there's an actual psychiatrist. Like, is there a difference there, and what's the?
Absolutely. So psychiatric providers take the nursing route, and the first 2 years are very science related. Mine was almost like pre-med setup because I hadn't decided whether I was going to go to be a medical doctor or a psych provider. And so 2 years, very scientific. You could have medical doctors in the same class, so that was the AA degree. However, the next 2 years, when I decided I was going to go to nursing school, it's very nursing oriented. So it was an associate degree in nursing and a bachelor's in nursing. By the time we get to master's level, we can treat medical conditions as well. We are trained in everything. Someone walks in, they have a cut on their thigh, I can clean it, suture it. If they need antibiotics, can prescribe all the way until they are healed. Someone with a cardiac issue, are they having angina? We have protocols to treat them. So at that point, we are not specialized at master's level, which takes 8 years of education. And we go on to specialized. Obviously, I specialize in psychiatry. That is the area, that's my realm of practice. That's where I feel my best. That's where I am board certified. Now, I have 2 semesters left to finish my doctorate, so can't use the doctor yet until then. But at that time, I would have done a total of 10 years of education.
Wow.
Yes, that's what it takes to be a DNP. I'll be called a DNP, Doctor of Nurse Practitioner. And there's about 385,000 practitioners in the US. And out of the 300, I think about 25,000 are psych. And only 2% of us are board certified.
Wow.
2%.
Wow.
And
so the gravity of that gap here in the US,
yes.
Now when we go back home, that's even worse, because that's a huge gap considering the population versus the number of you that are actually trained and certified.
Absolutely. And if you're looking for a Black one, good luck, because the entire US, we are only about 419, I think. So, and we know you really you want to go to a provider that you have a rapport with. Now, rapport, you can have a rapport with all patients from all backgrounds, but if you are a population that has disparities and you feel like you'll be seen by one of your own, it's a big challenge. I will be honest that the majority of the patients that seek me that look like me is because they've had unfavorable treatment elsewhere. With that said, it's really a good career path. Initially, when I picked it, I felt a little bit inferior. Like, I'm not going to be a doctor. If I'm going to choose something, I want to be on top. And the advisor let me know that the scope of practice differs from psychiatry because we put prevention at the center of it. And if we're going to prevent ailments, in psych, we have to consider biopsychosocial, medically, psychosocially, economically, because we are made of nature, which is the DNA, and our environment. We used to think we were all DNA, right? Like, no, the environment can cause our DNA to change. That's called epigenetics. So I love the scope of practice of psych, and knowing that I could end up being a doctor anyway. So I went through it. 10 years, I have 2 semesters to go. Where does it rank in the US? According to Newsweek and World Report, it's number 5 in STEM jobs. The entire US is number 4 in career and health, and overall is number 5 on best 100 jobs in the US, period. So that is where the psych providers stand. As far as psychiatrists, they're doctors. They go to pre-med. After pre-med, they go to medical school and residence. The difference in time is 2 years. They go to school for 12 years. We go to school for 10. Prescribing-wise, there are minor differences. So there are certain narcotics that I cannot prescribe. I can. There's a limitation. For, let's say, Percocet, if you've been admitted, you've had surgery, you get Percocet, Oxycontin, Oxycodone. Those medications, I have a limit as to how many I can prescribe a month. So those are some of the differences. Like I said, for us, we are preventative oriented, very holistic, very body, mind, and soul. For psychiatrists, they're much more acute.
Okay.
Acute oriented. So you will find a lot of them in the emergency room because they are preventing the worst that could happen. They get paid a little bit more, about 20% more than we get paid.
Wow.
One thing to outline, I think that brings me to Awesome Minds. And, some people think, why Awesome Mind? Is it your mind that is the mind that I think is awesome is the patient's mind. I bring the education, all of that 8 to 10 years. I bring the experience. I've been in the health industry for 19 years, and different levels, be it a CNA, a registered nurse, a clinical reimbursement coordinator for one of the biggest subacute facilities in Central Florida. So I know the business side of it. I know Medicare, I know HMOs, PPOs, and all of that. But above all, I bring an open mind. Knowing that whoever sits in front of me, they have a beautiful mind, and it's up to me just to fine tune it. So they feel heard, they feel seen, and they get the necessary medication that they need to stabilize. I hope I have outlined the difference.
Yes, you have. And that's why this field is really wide. And it's interesting as we get to pick up the pieces and piece them. But you outlined it so well. But outline, I know last time we talked about the 5 stages of grief. So those 5 stages of grief, and then how do also these stages apply to someone that is dealing with trauma, and then also what are some of the coping mechanisms, or how will each person be attended to at each stage?
Okay, that's a good question. I think what what I'm going to try to do here is once they're in the community, I'll let Leah also talk into that, because she's the one who will walk with them, either depending on their schedule. If she's seeing them once a week, she gives them assignments, she'll target certain things. But in general, as we are in the community, we'll go through them. So first is denial. We have anger, then we have bargaining, we have depression, and the fifth one is acceptance. So at denial, how do you know someone is denying? They don't want to go to the graveside, they don't want to talk about it. They really don't, they are short, in reaction. Sometimes they will minimize the gravity of what just occurred. It was just their time. Yeah, enough, you can tell out, she's gone. Or even, disparage them. Nizao, benze kuma, what can we do? Yeah, you can tell out. You know that they're not processing. What you want to do is just be there. Just be there for them. They will try to preoccupy themselves. How are you coping? How are you? I think last time when we spoke, someone in the comments said the most difficult response to give is when someone, after you lost someone asks, how are you? Like, where do you start from? Because you're feeling a lot of things, right? You look at these stages you're going through, you're questioning, you're shocked, you're dealing with a lot of emotions. Don't be afraid to be specific. How are you dealing with this? How are you feeling? Are you sleeping? Are you eating? They'll start to open up, and sometimes they won't. Sometimes they will tell you, I'm not dealing, I am preoccupied, I just made myself busy, I picked extra shifts, and they'll fill in the gaps where they're supposed to be grieving. They'll fill it in with something else. And I think the most important thing is offer them your presence, either to go to the gravesite with them, to make that real. Go through the pictures, whether it's going through the picture of the deceased, they'll start to process that this person is really gone. Whether it's arranging their things, this person existed, they are no longer there. So that will bring emotion and almost kind of put them, in the space where they can start to process. You don't want for them to continue to fill in, sweep it under the rug and do other things so that it doesn't hurt. It's okay to
so just there, Mutinta. So that's why those of us in the diaspora that are not home, like my mom passes out in Zambia, so I don't have the ability to go through all that, like talk to people about her, go through the pictures, go through her things, decide what to do with her property and all that kind of stuff. So that exasperates the trauma for us when you can't get it.
Absolutely. And you may perceive it as trauma, but at the same time, there are feelings that you need to process. There are feelings that you shouldn't have. It's natural. We are going to grieve. Don't avoid it, process it. And if you can't handle it, it's okay to deal with it in, increments, small increments. Give it space. I'll deal with my mom's estate on Saturday from 2:00 to 3, so that you can be in it, you feel it, but at the same time, it doesn't overwhelm you. And that's okay. Eventually, you'll be able to deal with it a whole day. It gets better. That's the bottom line. Move on. Just support them, be available, talk about it. If we are abroad, talk to your loved ones, talk to your sister. Understand, you will have questions, you will ruminate. Were they in pain? Were they made comfortable? You want to know all those things. Sometimes they will hurt you, sometimes they will be comforting. Hearing that when my sister was passing, she said, Mom, can I put my head on your chest?
Wow.
And she laid her head on my mother's chest. And minutes later, she was gone. And that gives me comfort that she wasn't laying there in pain. She was in pain. I'm hoping she wasn't, and my mom was there to comfort her, to hold her. I feel like she was secured. So those details make it better for me to grieve. So that is that. With anger, anger is tricky because when a grieving one they'll lash out.
That's number 2, right?
Yes, that's anger. They'll lash out sometimes. Sometimes they may feel envious of the person who's supporting them. How come it's happening to me, not you? And sometimes we use the wrong words as we are comforting our loved ones. I know how you feel. No, you don't. So that will aggravate them more and lash out. Sometimes we just don't know, what to say. God, they're in God's hands. We don't know if they're angry with God and you're telling that their loved one is, like, what are they doing with God? Where
They're
was
supposed
God?
to be with me.
Yes. And where was God when they were suffering? Like, I don't want to hear that. So when they lash out, like, just be there, be supportive, let them talk. Just listen, don't be judgmental, let them talk. You can encourage it. Tell me about this anger that you're feeling, and it will probably be specific depending on, where they're coming from, the factors in life. And if they talk, that is great. Encourage it. Sometimes it won't make sense. Your job is not to make sense out of it. It's just to be supportive and comfort them.
Pastor Nathan, a friend of ours that we know, recently lost a wife and child. I remember being at the funeral home, and then somebody coming. He's a preacher too. Someone comes up and says, "Hey, God," he was saying something about God knows, God will comfort you. Then he looked up and said, "This same God who has taken my wife." And so it was like, yeah. So I clearly understand what you're saying in your explanation, man. So you can't go and say, and that's the one he's saying, "Hey, how are you allowed this to happen?"
Exactly. Here's the thing. The other thing here, we have gyms every corner, right? It's okay to go take a walk. Going to work out in the gym, it sounds like, whatever, I'm grieving, I don't want to go to the gym. But it's very important to work, especially in this stage. Why? Because first of all, we are stressed. We've just experienced grief. Someone we love has just left us. The body is releasing cortisol. That's a stress hormone. That's the same hormone that we call backup. Oh, let's go adrenaline. Let's hold on to to fats and proteins, and it'll go in the midsection for men, right? Near the heart, and who knows, maybe, end up with high blood pressure. That's a stress hormone that we release when we have all this, grief and emotions and trauma. And it just starts a cascade that's unhealthy that can end up in a medical condition. Okay. Too much cortisol is not good. A little bit is necessary. How does working out help? It increases GABA. GABA is the calming neurotransmitter, literally. And there's research, you can see the brain being activated when you go out in the, I like to walk on the trail. Pastor Alan, I don't know if you've been to Hillsborough Trail. Go walk in there, 6 miles. You are in the woods. There's a little waterfall in there. I used that a lot when I was grieving my sister. Just there with the trees, and kind of sometimes would remind me of some of the times that we spent together. Go walk, go exercise. The GABA will go up, the dopamine will go up, the serotonin will go up. These are good calming neurotransmitters that help us feel happy and sleep better. So you can offer to go take a walk. Are you exercising? It doesn't have to be anything vigorous, but you can encourage them to get out. not to isolate, and most of the time when they isolate, it leads to to depression, which is the fourth one. But we're going to talk about bargaining. Oh my God, bargaining.
That's the third one.
Yes.
Before you go to bargaining, Mutinta, I want us to address this. You've talked about not knowing what to say, okay? Dr. Musoma here says, I call it the God thing. And remember, last session, we talked about this thing about Christians, where it's like if you go to ask for specialized care, therapy, and all that, it's like you're stepping away from your faith. But that's not the point here. I call it the God thing. Dr. Musoma says it is so not comforting. Okay. This thing of saying it's amazing how people will say is in a better place. Can you address that?
How dismissive is that?
Wow. Dismissive is the word, right?
Yeah. You are literally dismissing. He's in a better place. Wow. Have you?
Sorry to cut you short. So dad being with me wasn't a better place.
I'm sorry?
When we say he's in a better place, so that means my mom, my dad, my brother, my sister being with me wasn't better.
No. And we're not acknowledging, we're dismissing their pain.
Pain. Yeah.
Like, why are you suffering? Like, stop it. They're in a better place. Like, no. Acknowledge that they miss their loved ones. They wish they were there, and they are no longer here. Now,
is there a point where you could say, like, for instance, if someone was in pain while they were alive, so when they pass on, like, we're told there's no more suffering, no more sorrow, no more pain, is something that we quote a lot in the church. Is that applicable to when someone was in pain for a long time, and people will say, well, at least they go rest?
Absolutely. There's a place for that. There's a place. So the key is knowing when to say that.
Yeah.
Knowing when to say what?
When to say that. If they're in the anger phase, you're telling them they're in like, that is not going to fly. That is going to aggravate them. When they've gotten to acceptance, where they're where they are being hopeful and trying to be they've started to appreciate the times that they spent with their loved ones. They've started to entertain living a happy life after this. Then you can look. That's when you can bring that up. Your mom did really suffer, and now she's in a better place, and I'm sure you wouldn't want her to continue to suffer the way she was suffering. But there's hope in the future. Let's honor her the best way that we can. There's a place for that conversation, but I think we don't know when to use it.
Okay. That's a great point right there.
Absolutely. So, bargaining, my goodness, I think my children, after they watched the last episode, my daughter was like, Mom, you killed us with your bargaining. Like, we couldn't take it. Like, what if, and all that. What if, and, they're blaming.
Yeah.
They're blaming. If the call came and If they called me by video, I could have said, if they did this. So as a person who's comforting them, again, just be there. Just listen. Most of the times they're probably not being reasonable, right? You can actually counter, like, well, I don't think so. I think that won't be helpful. Just be there and listen and encourage them to seek help. Because sometimes I think when we are grieving and we are on this stage, we sound like we are whining.
Yeah.
And that can be irritating to the people that are supporting us. And it's okay to say, let's seek therapy, someone that can hear them once or twice a week. You don't have to, or even if it's not therapy, you can seek counsel from the church. We have those resources. Let's go to a support group, where people who are going through the same thing are there, and they want to talk about it, because talking about it is almost like soothing also. So those people are almost in the same place as you. So, it's a place to whine, so to speak. But if we are supporting our loved ones, and they're not going to, to counseling at church or a therapist, let's talk about it. Encourage them to talk about it. You don't want them to feel hopeless. That's the goal.
Okay.
Because they can easily slide into depression. So just be there to encourage them. And the church is really a good place for people like me who stay in the bargaining place for too long. So, important one, acceptance. That's number 5.
4.
That's number 4. We've done
No,
denial, anger,
acceptance is
bargaining.
number 5. I'm gonna jump to number 5 first, which is acceptance, because depression, which is number 4, is heavy. So with hope here, hope is the main thing. Once you start to accept, you want to encourage them to be hopeful. I think the church here can be very encouraged. They are spiritual. This is when you can draw them in, give them something to look forward to, that they can have a life after. It's a new norm. It's not a norm maybe they would have preferred, but they can still make the best out of it. They are more open to the things that we usually say maybe when they're in denial, anger. This is where we can chime in and instill hope to them. And I'll talk about depression. It's number 4, but we're going to talk about later, because this is when I see the patients. This is when they come to see me.
When they're in depression?
When they're in depression, when they are in denial, they're not coming. It hasn't happened. So they're not coming to see me. When I've seen some in anger, because I do treat anger as well. I'll see them very challenging in anger, but majority of the patients, when they're grieving, they come to see me when they are depressed and anxious. They have either stopped eating or they are overeating. And you're wondering, I understand not eating. How do they overeat when they are sad? So the neurotransmitter that helps us to be happy and sleep well is called serotonin. Neurotransmitters are biochemicals that are in the brain. So serotonin is about the only neurotransmitter that's made in the stomach. So when we are sad and we overeat, we have a copious release of serotonin. So it's soothing. It's like medication, right? So they come to see me. They've gained so much weight. They don't feel good about themselves. They are sad almost all day, every day. And they've lost interest in things that they used to do. They are hopeless, and they don't feel the zeal to live anymore. They may have, suicide ideations, and sometimes they plan to go through it. And intent, I'll go through it on Sunday after church. I'll pray, and then I'll go jump on the Bay Bridge. If there's a plan and intent with their being back acted, they're going to the ER. They need to be supervised every day. But if they have no intent, they can have a plan. They have no intent, I can treat them here.
Is there telltale thing that you can tell when someone is on on the verge of, I need to just go take my life?
That's a good question, right? So there are stages of that. Sometimes they'll just, they'll say it. You can see them being serious about it, and they're going to do it. But the key thing to tell that someone is going to go through it, over a sudden they have resolve. They went from not getting out of bed, not eating, isolating, super sad, and can't concentrate. And every day they want to kill themselves. And over a sudden, they have resolve. They're giving away their personal items. They're happy. And then you're like, what happened? The medication working that well overnight? The antennas go up because they have resolved, they have made up their mind that they're not going to feel this pain anymore and they're going to end it. There's this sudden sense of resolve. Those are the key things. It's not getting better, is not going to be overnight. Like they just wake up and I'm done, I'm good, everything is so good, and I'm going to take a trip, I'm going to retreat and and I'm giving this and I was feeding the there as a provider. I'm looking at them like, okay, I think we should schedule an appointment next week. I would like that. And sometimes when I do that, it catches them off guard. Next week, because I'm disrupting their plan of what they want to do before they end it. So at that point, for me, they're going to the hospital. They're going to be better acted. So there are a lot of things that we consider, but those are telltale signs that they're going to go through it. Lack of support, them not being heard, them not taking their medications, most of the time leads to them going through it. And sometimes as provider, you can do everything. And if they're just meant to do it, they'll go through it. But that's a great question, like what to look for if they're going to. And if you're in the community, they're giving you the plan. Like I could just end it. I have begun, maybe after church. That's plan intent. Feel free to call 911. Please do call 911. I don't think in the community we realize, I will encourage you to look at the statistics of people actually who go through with killing themselves.
Wow.
So, it's very serious. So good question. Be engaged, visit them, be there. At this point, we want to encourage them to seek help. Not everyone is open to doing that. Seek help. I think as leaders, in the community, in the church, I think you should have a psychiatric provider, psychiatric provider that you do work with. I think there's a lack of collaboration between the church and psych. And if we are to bridge the gap, we really do need to work together because at the end of the day, we need each other. We need each other. You have more contact with the congregants, with the community, and you hear what they're going through. And most of the times they're attributing it to lack of faith.
Yeah. There it goes.
That
there
right
it goes.
Yeah, that right there is hitting at it.
There we go. Mutinta, I don't intend to. Here is something that Matilda is bringing up. Address the stop crying, don't cry when the passing has just happened, the impact of those words.
Oh my gosh. Why are you stopping crying? What is the reasoning to stopping crying? That is the normal reaction. Please cry. Please cry. That is the normal reaction when something like that happens. Yeah. Don't cry. Be strong. No, I'm not strong. And it's okay not to be strong right now. I'll tell you, when my grandmother died, 2010, I believe, I worked in geriatrics at the time, and I had asked my cousin Wendy to bring her over so, I could see her and she could be there for my graduation and all of that. And I graduated that May. She passed in October. And I remember, they here when bereavement, they give you 3 days. Like, what
Okay.
is 3 days? So I go 3 days, 3 days, I'm still in denial. And I'm supposed to go back to work. And I go back to work, and I'm supposed to be taking care of the elderly. And they are, what, 96, 98? Then I'm questioning God, like, I couldn't get one more year just to see my grandmother? Just one more year. Like, how unfair. So I remember that triggering my bargaining. And it was on from there. And my husband at the time, like, come on, use your PTO, just come home. I couldn't function. I couldn't do my job. I was angry. I was bargaining with God, and I wanted to cry. 3 days was not enough to mourn the woman who's responsible for who I am today. Everything good about me is from her, and I'm supposed to grieve in 3 days. Like, no, it just started. So I took my 10 days PTO or whatever, and some of it unpaid, and go home and wail the best way I know how, because that's how we mourn where I come from. The Ngonis, they would do their thing, and the Tongas with their spears. There were no spears, but there was the wailing. And that's okay. I sit on the floor and I cry. I remember her carrying me on my back and praising me when I was number one. I never got anything in the village, never got anything below 3, top 3. And she would make sure the village knows about it. My intelligent granddaughter, all the confidence that was in me was from her. I wailed, I cried. There was no stopping me. And when I was done crying for those 10 days, I was back to work. It's necessary. Scientifically, we release endorphins. Even you can take the tears and actually test that. We have endorphins in the tears. They are meant to soothe us. Please don't stop crying. Cry is the process that is necessary for healing, especially when we lose our loved one. That's a misconception. We should cry.
Yeah. That makes sense. Grieving is the normal process. Allow people to cry and let it out.
Yes.
Brother Barney had posted something earlier here. Just one moment, Vala. It's like saying he has gained in death. I think he's referring to that point we talked about. They're in a better place. Okay. He has gained in death, giving an example of apostle statement when they say he's in a better place. They are right from a spiritual point of view. That statement sounds insensitive, especially that it misses out on the psychological, sociological, and emotional part of grieving. Yeah. That is why having a person like Tembo can bring in a balance. We're not just spiritual, but physical, emotional beings. Thank you for that.
Well said.
And Dr. Kasonde also again says excellent point regarding the bridging of the church and professionals. Here's what I want us to do. Everybody, the reason I'm putting that website there for Mutinta's practice is for you to go there and know how to get in touch with her and get some information from there. And this is not just a conversation or just a talk about, and that is why the theme is coping with grief and trauma during the holiday season. This is one of those times in the year when we come to terms with the loved ones that we have lost in our lives. I'm going to do something here. I want us to do this. Can we deal with the last one at the end before we conclude the show? Depression, since you said it's a big one. Yeah.
Well, I think we've literally just covered it in there. Most of the times, you just look for sadness all the time. important point I wanted to stress with depression, it's constant, almost every day, almost all day, for at least 2 weeks. Minimum is 2 weeks. If they are sad, they have lack of pleasure in activities they used to like, they feel bad about themselves, they feel guilt, they're not sleeping, they're not concentrating at work or anywhere else. Those symptoms are clinical and they are persisting almost every day, or almost all day, every day, for at least 2 weeks. They're clinically depressed. With the depression that comes with grief, it's intermittent. So you want to see breaks sometimes, then what people will say here, how are you doing? It's like a roller coaster. That's what you want to hear. It's like a roller coaster because it comes and it goes. Sometimes I feel good and sometimes I don't. When they're clinically depressed, it's constant. There's no break. That's a very important thing to look for as you assess whether someone is depressed because they're grieving or someone is clinically depressed.
Okay. All right. Well, we're going to transition here. Mutinta, we have some guests, I believe.
Yes.
All right. Who are we going to hear from first?
Oh, this is one of my favorite therapists. As you, my brothers, know, I have worked or still work for a major psychiatric company in Florida, and we met there. And just know that I was exposed to thousands of therapists, and she stood out. And her name is Leah Taylor. I am blessed that she agreed to join me at Awesome Mind Psychiatry. One patient described as Kobe and Shaq. And I wanted to be the Kobe, and Leah is the Shaq because she will slam dunk.
Okay.
Welcome, Leah Taylor. She is a licensed, go ahead and introduce yourself.
Hi, everyone. Once again, thank you for having me on the show. I am a licensed mental health counselor and founder of Serenity, Peace, and Love Counseling, LLC. And just a little bit of my background, I've been lucky to be able to work with Mutinta. I've also worked with kids in the high school systems, rehabs for substance abuse, psychiatric hospitals and facilities, as well as outpatient. So a little bit of everything.
Okay. Leah, welcome. We're glad to have you here. Before the end of the show, we shall give you a Zambian name and the village as well.
Yes.
Okay. When does one seek psychiatric help, Leah? And what are the signs to look for?
So there's two parts to it. So usually if you're looking to go in to get psychiatric help, usually we're at a place where we're needing medication. There are certain psychological disorders that do require medication. So things where like bipolar disorder, sometimes if people have severe ADHD, certain things like that. Usually your therapist is where you'll kind of sit and talk for about that hour and process through things. And then when you need to kind of have medication to regulate those things, you can process with Mutinta or a psychiatrist.
Okay. Is medication the solution, always the solution to this?
No.
You know, especially us men, we are very wary about taking medication. I'll tell you about that myself. For me to take medication.
So a lot of times medication has that stigma attached to it, right? For many of us growing up, it's like, oh, you must be crazy or something's wrong with you. But I always look at it this way, right? If you get the flu or you get a virus or you get sick, right? We're going to go reach for things like, I don't know, cold medicine, things like that. Some of us might use regular ginger and things like that to help out. It depends on the person and the situation. If your ADHD is not disrupting your life so much and you're able to function, then maybe doing therapy is more helpful. But if you're dealing with something where you're flipping, like bipolar disorder, and you're flipping through high manic episodes, you know, you're not necessarily in the right mind all the way. Sometimes we need a little bit of medication to help. Same thing with depression. Sometimes life is lifing and it's situational, so you might not need medication for that part of it. But then if your serotonin levels are really depleted, you kind of need some chemical help to balance things out. And it doesn't mean that anything's wrong with you. If you were diabetic, you would take insulin, right? So medication for the mind is kind of similar.
Absolutely.
Yeah.
And
Yeah,
whenever patients come to me, I am the medicine girl in this partnership, right? So when Leah thinks, okay, therapy alone is not going to be enough, that's when she sends them to me. And vice versa. Not everyone that comes to me will end up getting medication. We have these tools that we use to assess, do they need medication? Is this behavioral? Is this medical? Sometimes, like I said, I'm qualified to treat medical condition. Do they have hypothyroidism? I'll check. How is the A1C? Are they diabetic? Because if they're hyperglycemia, they'll look like they have ADHD. They're hyper. If they have hyperthyroidism, their metabolism is fast and they're losing weight and they're not sitting still. They're always hot, So I have those symptoms and I can order the labs and see where they are. And sometimes it has nothing to do with, the brain. It has everything to do with medical. So I'll refer them to an endocrinologist or, cardiac if it's cardiac. And then sometimes it's just behavioral, like there's no structure. I need coping skills for you. Then I'm like, Leah, please help me out. Can we come up with a treatment plan? So not everyone needs Medicare. We have a lot of patients that I see still manage. They don't need medications and they do get the therapy from Leah.
Let me throw in. Okay, go ahead, Alan.
Just from the explanation, how they transition from what Leah does to what Mutinta does, and then if both of them can't cope, they've got a place to point them. So when it comes to the church world, that's where I was questioning, where is the crossroads? Because there are certain things that we will pray, like for instance, if it's demonic activity, you pray, a person is set free, they're good. But we see the reoccurrence, and some of it is like Mutinta said, behavioral. How do we bridge that? And I think as Christians and in the churches, that's something that we have to actively seek to answer. When do we there's counseling, there's therapy, there's actually now when you have to go into medication, where is that, and what role God plays? I love the example you gave. You even though you were kind of you prayed for your daughter, she went through the surgery, and God worked a miracle using what the surgeons did, that the meshing was so supernatural, and so even when it comes to mental health, you don't just say, hey, no, you can't have those thoughts, they're demonic, we'll cast them out and now set you, but the person goes back to that same environment, and maybe the triggers are in that environment that they are going back to, and I think that's one of the areas that we miss it.
I think sometimes we think everything is so separate. Your mind and your body, your spirit and your soul is all connected, right? And it's all one thing. If one part of that dynamic is affected, then everything else will be affected too. I always look at it as God provided these tools and these skills, right? Otherwise, everybody would be in these particular fields or arenas. And so it's important to look at both. I think we can have both things. You can pray and acknowledge that we want to make sure we are relying on God and things are working out in one aspect. But then, like you said, sometimes there's trauma, right? If there's demonic things going on and you've survived it, right, or you're still laughing, that might leave you with a little bit of PTSD depending on the situation. And so then it's good to look at the other arenas. Do I need to go to therapy? Do I need to get medication? Sometimes medication is something you're on for a short period of time, and then the rest of it is just counseling, or vice versa.
Let me ask this question as we transition. Let's hear from the people watching or listening, whichever you are doing. That's a WhatsApp number to call. It's a Zambian number because it allows the people in Zambia to participate as well. What happens, Leah, if one doesn't grieve?
So I always look at it sometimes like a broken bone, right? So like mental health is like a broken bone, right? You don't go to the doctor, you don't get treatment, and that bone hurts so bad every single day. You finally go get treatment for it, and they have to re-break that bone open again and then set it back properly. And it hurts like heck, right? You want to scream and cry and everything else. But after that bone has been set back and it heals properly this time, life is a little bit easier, right? You won't forget that the bone was ever broken, but you're able to maneuver a little bit better. And so I think the same thing applies when it comes to mental health and things like that.
Mental health. If you don't grieve, it will still be there. It will still linger.
And it erupts like a volcano sometimes. There's times when you're moving and you think that you're okay, and then somebody brushes past you and then you just snap, right? And you're looking at that person like, what's wrong with them? Well, that might be some unresolved grief that's been there for a very long time. So it's very important to grieve. Crying is so essential. We get taught that, I remember growing up, my mom would say, oh, if you don't stop crying, I'm gonna give you something to cry for, right? And we forget that a lot of times crying is therapeutic. You feel like you release all of that energy. You're able to process things a little bit better, and you're able to talk. It's a way of self-soothing. We see babies cry all the time, and they cry themselves to sleep.
So we tend to look at it as being unusual or erratic behavior when somebody is continuously in the process of mourning and they are crying. Why don't we just accept and leave the person to go through that process?
A lot of it's a trauma response too, right? A lot of times our parents didn't have the emotional space to cry because they had things to take care of, right? And so a lot of it is meant for us to build up and just keep it pushing or suck it down. It's just that what we find out is as you get older, you can't just keep pushing it down because, like I said, it'll eventually erupt like a volcano. You become more in touch, more emotional the older you get, and it gets harder to just suck it up. As well as just the way trauma manifests in our bodies. A lot of times people don't realize that, but those frequent migraines or your inability to eat food or the ability to eat too much food, lack of sleep or not getting enough sleep, all these things have an effect on us. So it's important to grieve, to cope.
Yeah, it's very important.
A good point to add on that. Most of the times, if they don't explode, they're going to soothe it in maladaptive ways because it's there. The bone is broken, like Leah said. If it continues to hurt, they don't process it. They're going to soothe it in ways that are maladaptive, such as drinking alcohol. They use marijuana, and that's another can of worms that you just opened. Alcohol is a poison. Alcohol is a depressant, really, by definition. And the thing about alcohol, it will be absorbed by the brain. It can pass the blood-brain barrier. Certain things cannot pass. Alcohol is both water soluble and fat soluble. So guess what? It will get to the prefrontal lobe where the calming effect, the GABA, is. And then we're just like blah. We are not functional, and we're even more depressed. It will affect dopamine, which is responsible for memory, executive functioning. And then we look at people after they've grieved and they're coping with alcohol. Ever since nothing productive is coming out of that. They're coping with the poison, with alcohol, or even marijuana can affect the brain in ways that are not pleasant. So we want to cope the right way and heal that bond that Leah talks about. That way we don't end up using maladaptive behaviors.
And also a lot of with those
sorry,
things.
I was going to say, sorry, Leah, but just to be clear, it's not just it leads to alcohol or drugs, because there could be a person like me. I can, after we're talking more and more, I'm realizing I have not mourned my mom the way I should have. Period. That, I can't even hide behind nothing anymore. But it did not drive me to alcohol. It didn't drive me to any kind of drugs, especially being a preacher. Like I said, one of the things that I'm doing is delve deep into helping somebody else with their stuff. That's one way that I do it. And then also the other one is just work. Like I'm just constantly working, just like the last 4 years. I haven't not even to Clearwater Beach, and it's like 20-30 minutes away from here. Nothing to relax on your table, but just the work and that. So, and then also the other thing I wanted to ask is, it's been 20 years since your loved person passed, and you didn't go through that grieving stage. Where do you go from there? Like, it's been 20 years. And if you describe me, I'm happy, I'm lively, I'm like, on the surface, I'm all the positive things.
So a big part of it, like what you're mentioning, is when you're not dealing with it, even whether you're using chemical substances or you're diving into work and we're looking, because ideally we look for distractions, right? That's what the human brain goes to. I don't want to feel this. I need to find a way not to feel it. What tends to happen is when you have that moment, that downtime to yourself, the thoughts and things start creeping back up, or the feelings come up. Or like you said, it's been 20 years, but then you watch something and something triggers a memory, right? And then now explosion happens, or those things come up for you. So ideally, being able to sit with some of the discomfort and uncomfortable emotions is what helps you process. A lot of times I'll tell people to write letters or like journal, right? Because that allows you to put out the feelings of what's happening and then being able to move forward. And then we would increase some of those coping skills, right? Your amygdala, that emotional center of your brain that deals with all these strong emotions, like Mutinta said, the prefrontal cortex shuts down. There's no access to the hippocampus, which deals with memory. So we want to learn, how do we regulate? A lot of the coping skills are to help you regulate those emotions, which is your amygdala. Once the amygdala is calmed down, prefrontal cortex and logic can kick back in and kind of give you those things. So we're looking for like a balance with it, right? It helps you to look at things when you are grieving, when you're recognizing memories or things are triggering you. How do you handle that? Because you're not, just because you know what your triggers are, it doesn't mean you're not going to be triggered anymore, right? But the idea is that it gets easier each time. The first time that death happens, you might have cried every single day, right? Over a couple of years, you might just shed a tear on the anniversary of that death, right? You find different ways to celebrate that and to navigate through it.
Okay. It's 1800 hours right now in Central African time and 10 a.m. in Central time in Dallas, Texas, 11 on the East Coast. Those of you that are joining us, at times, I know some of us express ourselves better by writing or typing. Others, we express ourselves better by talking. So if you're one of those who wants to say something or you want to ask a question, that's the number on the screen. It's a WhatsApp number. The reason we're using a Zambian number is for our Zambian friends to be able to, our Zambian listeners or viewers to be able to join us. Okay. We have a very special guest here. Miss Mutinta has brought us a special guest. Shall we go with Taylor first or with Miss Smith?
Let's go with Taylor. With Taylor first.
With Taylor. Okay. Hi, Taylor.
Hi, everyone. Thanks for having me. So a little bit of background on myself. I'm a student. I work full time also on top of it, and I live with schizoaffective disorder, bipolar type. So it's like symptoms of bipolar and then symptoms of psychotic illness like schizophrenia. I was 19 when I got diagnosed with it, and it's been very challenging to navigate school and work while having a diagnosis like this, because it affects my moods, it affects my like cognition, like my perspectives on the world. But over the years, I've been able to, I guess, I've been able to cope with it through medication, through therapy. I've worked, Mutinta has been prescribing me medications for, I would say, over a year now. I don't know how long we've worked together, but almost 2 years. So
oh, wow.
I've really been able to utilize medication to help me achieve my goals in life instead of kind of letting it batter me down or anything. So over the past couple months, in October, I lost my mom to breast cancer. And so I feel like when she was talking about the stages of grief, when Mutinta was talking about the stages of grief, I feel like I'm still in denial some days and then in acceptance other days. It's really hard to get over losing a mother or a parent or a sibling or anyone that close to you, because they're your whole support system. They've been with you your whole life. And I feel like my illness, my condition is exacerbated by stress. So being so stressed during this time, I've been, seeing things that aren't there, hallucinating, and my mood has been affected. I've been more angry, more frustrated by little things here and there. But I've worked with Mutinta to be able to, look at the details of what's going on and take the parts that I'm not happy with, and then we work on those. So either by exercising more, by adjusting medications, all that stuff. And I mean, I've faced a lot of stigma with this disorder too. I mean, my employers have discriminated against me. People in school have treated me differently. People in my life that I disclose this to have treated me very differently because of it. But the way I look at it is, if someone is meant to be in my life, then they're going to accept it. And they're not going to look at me differently. So, I'm trying to turn it around into something positive in my life, instead of letting it beat me down and just get more depressed about it. Instead, I'm trying to advocate. I'm a social work student, so I want to go into therapy. I want to work in like nonprofit organizations eventually after I finish my degree. And I want to advocate for people who are either going through the same things as me or are going through something similar, because being young and getting diagnosed, you struggle to find others similar to you, especially with a severe mental illness such as schizoaffective disorder. So I'm trying to make a community for those people to feel included. And I feel like I also wanted to say that Mutinta really makes me feel heard and seen. I mean, she's the first professional that I've worked with that actually makes me feel like I'm important, and I'm not just someone to just give medication to, or just push, oh, we're going to have a 5-minute session and then we'll see you in 6 months. She checks up on me. She communicates with me, and I'm forever grateful for that, because I've had such bad experiences with mental health professionals in the past, which is so discouraging when you are trying to get help, even if you have something like depression or anxiety, something that, is more common. There's still so much stigma surrounding all mental illnesses. And I just am so grateful to have found a provider who really does care, I feel like.
Taylor, thank you so much. And a dear friend has posted something here. I don't know whether you saw it. Thank you so much for coming over, Taylor. Very heroic. Now,
thank you so much.
Here is a question. Either you, Taylor, can respond to this from a personal experience view, or Leah or Mutinta. When we just ended the show 2 weeks ago, a dear friend posted a comment, but I couldn't show it because the show had already ended. Okay. He's friends to both Alan and I, a pastor as well, Dunstan. He said something that Taylor said. Taylor, you've addressed the issue of stigma when you opened up to people at school and stigma. So Dunstan said one of the major reasons we do not open up about this situation is the fear of stigmatization.
Yes.
So Taylor, to you, a direct question, and then Leah and Mutinta can come in. Did you ever regret to say, oh, maybe I shouldn't have talked about this to these people? How did you process? First of all, why did you decide to share your situation with the friends at school, or you shared with them at work? Because I would think, hey, this is my personal matter. I better keep this to myself. Why did you decide to share it?
That's a great question. Thank you. So I decided to share, well, first to my employer, I decided to share at the time. This was when I was younger. So I was probably either freshly diagnosed or I was like 20. And I was really struggling to get my medication correct. So I was struggling with symptoms, and it was very obvious that something was wrong, and it impacted my work. So I came to my employer, my main boss of the company, and I said, I'm struggling with this. This is my diagnosis. I just need to let you know so that, if I need to take a minute to go to the break room just to calm down, or to take a medication to help me calm down, then I can do that, and it's not going to be like I'm going to be penalized for it. And I faced from that employer, he looked at me and he said, well, you don't look like you have schizoaffective disorder, and I don't think you have it, so I'm not going to let you do that. And it blew my mind, because mental health is in your brain. I mean, mental illness is in your brain. No one can see it. It doesn't look like anything specific on the outside. So that was what I faced there. And then for school, the reason I open up about it, or I used to talk about it, I just wanted to see if anyone could relate to me. But now that I open up about it, I'm opening up about it so that I can help people to not feel like they're alone. Like I'm a person that is there for them, if they're going through anything, even if it's just grief, even if something I don't have or I can't relate to, I can still try my best to relate, and they know that I'm there for them.
Leah, is the risk worth it?
It's such a catch-22, right? Because on one hand, I think it is important that we have these conversations and work on destigmatizing these type of situations. But what Taylor's expressing is, on the back end, it increases the anxiety and even feelings of maybe worthlessness, sometimes isolation, because you're opening up for a good purpose, and then people are shunning you or staring you down for that. And so I want to say, yes, ideally in a perfect world, yes, we should share, we should talk about these things, but then you do have to balance out, how is this going to affect your career? How does this affect the things that you need? Because you have to be able to afford your life and your bills. So the original question of the stigma, this is why I got into this field. I'm so passionate about mental health for these reasons. Growing up, Caribbean background, it's like, oh, again, something's wrong with you, or you're crazy, or you can't express these things. Meanwhile, everybody's going through some type of mental health.
Be strong. Don't cry.
Don't cry, right? And even when it comes down to things like suicide and all this stuff, and then because we don't talk about it, there's not enough awareness. No one knows where to go to get this help and things like that. It's also why I love Mutinta and sending clients to her, because I know that when I send them, she's not just going to write a prescription and send them off on 15 pills, or not listen to them, or not be heard. I hear so many clients say they don't have good mental health experiences, and it breaks my heart every single time. So Taylor, I'm sorry you went through those experiences. I'm glad that you found Mutinta as well. But in the world, we do need to destigmatize. We do need to put information out there to help people understand, hey, this is what mental health looks like. And mental health does affect your physiological health, right? Your physical being and all these other things too.
Pastor Nathan, I wanted to ask the ladies, is there a place where maybe I've not been diagnosed with anything, and just for my mental well-being, I mean, if I want to be healthy, I start going to the gym. I don't have to be 300 pounds, start going to the gym, or start eating right. I could be just like, man, I just want to feel a lot better. And so that's kind of like preventing. Do you have to wait until it's a crisis before we seek mental health? Because that's the stigma around everything to do with your mind. You don't go schedule just a counseling, mental health, this or that. But last week you mentioned about professionals in high positions coming for therapy or coming to seek your help, and then thinking, how can they even function? Or do their employers or their clients know what's going on? If they knew, would they still go or seek their services in their professions?
Yeah. So first of all, Taylor, you are so brave. You've been an inspiration. I've seen you go through it. Details I'll leave up to you to say. And seeing you, take care of your mom to the end, and seeing you coming to me like, I'm not performing well in school, and outlining your needs, what you needed to get to a better optimal place. And seeing you in October go through it, Leah can attest to that. Usually we absorb patients' emotions, and we try to be strong because they are leaning on you. And Stella is an only child, and the mom.
Mutinta, did you say October? Are we talking about the month before last?
Yes.
That's when your mom passed, Stella?
Yes.
Yes.
Let me tell you, we went through it. She said, I'm not going to make, this is hard. Can I get an accommodation? And I'm just like, okay. And I'm thinking about her. I'm changing her treatment plan. Are you working? We talked about let's work out. Because I knew she was going through these stages, and I looked at where is she, and I would assess when we talk, here's where she is. So I would give her suggestions of how to deal with it. And when she came to me, academically, she wasn't doing good. And I was worried that if she slides academically, that will send her also in another psychotic episode. So making sure that her medicines are optimized, that she's getting therapy. Are you going to therapy? Make sure you schedule more therapy sessions so you can work
I will.
Yes. And she came back last week, and first thing she said, I have OAs, I have hundreds, and she's just glowing.
And
thank you. Thank you so much.
She's glowing, and usually I don't show emotion, and I think it threw Stella off. And at that point, it was like a release for me because I was there. Okay, we're gonna do this, Stella. You're gonna be okay. And finally, she's okay. And I knew that sometimes she'll go back and forth in her grieving process, but she's being hopeful. She's being hopeful. She knows that there's a future, and she did seek, my help, the therapist's help, eating right or working out and managing to forge along. And I was just so proud of you, and I couldn't help my emotion. I'm like, excuse me, I'm going to take a walk. I'll be right back. Leah and I are passionate about what we do. So I just wanted to say I'm so proud of you.
Thank you so much.
Keep talking about it. Keep talking about it. We need people like Taylor to talk about this in our own communities. Let's say in Zambia, with Taylor's diagnosis, it would be someone who doesn't have a home. You know what that looks like. Last time we talked about Gunyu massacre, right? That would be Gunyu massacre's diagnosis. Look at the face of Gunyu massacre and what Gunyu massacre looks, and look at Taylor. This is what help can do.
That's right.
It's important. Earlier, it was asked about when to go seek therapy. To be honest, I think anyone can get therapy at any time, and it doesn't have to be. Sometimes I work with couples doing marriage counseling, and a lot of times I find people always come when one foot is out the door, and then you want your professionals to be magicians, right, and to poof everything away, and that's not usually how it works. We want to make sure that we're treating those symptoms when you first start to see it, right? At the first stint, if you're noticing that you're having time and you're having a hard time sleeping at night because your mind is racing and you're having all this anxiety, go, seek help then. Seek it even when you're like, hey, I'm kind of okay, but this thing might be something or it might not be anything. It's okay to just go and process it out, because at the end of the day, it might be nothing and you might just need 1 or 2 coping skills, or it could be something. And then what is the worst thing that can happen? You got to have a safe space and work on some things. You leave with some tools. Everyone can use therapy. Everyone can go consult a psychiatrist when needed. You don't have to wait till you're in crisis or a rock bottom.
A lot of us keep a lot of stuff to ourselves. Before I bring in Ms. Chantrell Smith, a lot of us, and I was telling this, Taylor Leah, I was telling this to Ms. Mutinta. I said, I always have a problem pronouncing this word. What did I say, Ms. Mutinta? I'm a person who compartmentalizes stuff. Okay? Yeah. How do you bring me out? It's very difficult you can't even tell. You see, even when I'm scared, you can't tell that I'm scared. Even when I'm fearful, you will not know that I'm fearful. But I think that's dangerous to some extent, isn't it?
Very well, to some extent. So Mutinta said before, we absorb. So we're both empathic. So a lot of times I will have clients that kind of come in and they're like, oh, stoic, very poker face. And I'm like, oh, your stomach is doing flips. Your chest feels really tight and heavy, right? And we have those conversations. So that's one. Two, just existing in the world as a Black woman, I understand that a lot of times men are held to a particular standard of holding all your emotions, don't show anything, things like that. And it's a survival mode. I always express to clients that it's a safe space because that's very important. If there's something that I'm doing that makes you feel uncomfortable, I want you to talk about that and share that because it's my job to kind of attain or manage that as well. But the flip side of it too is that therapy or psychiatry is about what you guys bring to the table, right? I can't read your mind all the time and know what's going on. So each person has to be open enough to say, hey, you know what, I genuinely want to give this a chance. If you go and speak to any provider and you feel like there's something off, they're not listening to you, things like that, get a new provider. I always encourage people to advocate for themselves as well. We're here to serve you, right? But in order to serve you, you know yourself better than anyone else. You have to tell me a little bit about what's needed to make that more comfortable so I can do my job to the best of my ability. So it's a partnership or a teamwork, so to speak.
Okay, excellent.
And compartmentalizing, I mean, it's a coping mechanism, right? Depending on how you use it, you can use it for positive or it can be detrimental, very detrimental. Now, when you put it in a compartment, what do you do with it? Does it sit there festering? Do you address it at some point? Because one important thing to know is your brain may think you put it in a compartment, but the body keeps score.
I need to read that book.
It's my favorite. It's one of my books that I love. I love that book so much because again, our body, it's a physiological response. When you get really anxious and your body starts stress sweating, that cortisol, that adrenaline is running, right? All of a sudden your heart's beating fast. When you're super depressed, sometimes, sorry, I get a little passionate, so I apologize. Sometimes when you're depressed, your mind feels so low. You're so tired. You can't eat. You can't even get out the bed or even take a shower sometimes because you're so stuck in such a low place. Our mental health affects our physical health, and it's so important. People go to the hospital thinking they're having a heart attack, and it's really just an anxiety attack all the time, right?
Absolutely.
So we have to bring awareness that, hey, your mind and your body is not that separate. There is a mind-body connection. It is physiological as well.
Okay.
Most of my patients with anxiety, I would say 90% of them, their first reaction is, I felt like I was dying. I was having a heart attack. My heart was pounding. My blood pressure was 170 over. Physically, they were showing symptoms that showed like it's a heart attack. And they go to the hospital, they run all the diagnostic procedures, and everything is okay. And then they refer them, go see a psychiatric provider, a psychiatrist, and they come to see me. It was anxiety. So what you do with what you're putting in that compartment, is very important. Process it at some time. Maybe it works for you in the moment to handle the situation, but do make sure to deal with it because it might come back to haunt you.
I was going to say a lot of times we think we're compartmentalizing, but it's really presenting as certain levels or different diagnoses. So like for victims or people that have gone through a lot of sexual assault and sexual trauma, that PTSD and that compartmentalizing might look like, oh, well, I'm just very aware in particular, or, I present this particular way. So it is good to sometimes just check in and see, okay, well, what does this mean, right? And what does it really mean to compartmentalize? Because I have to say, it gets kind of hard to do the longer time goes on, right? The more trauma, the more things that occur, the more stress that happens, well, all of a sudden that volcano erupts, right? And you find yourself in crises.
Miss Chantrell Smith, good morning.
Good morning.
We've kept Chantrell waiting in the background for a long time. We need to pay her $1,000.
Hi, Miss Smith.
Hello.
Welcome.
Oh, thank you. I'm happy to be here.
Let's talk about your experience, your situation. You lost your sister a couple of years ago?
2021, September.
Okay.
So just to give background, I've been having symptoms of depression since childhood. Like middle school, it got to a point where, I would hide under the bed when I didn't want to go to school. I was almost expelled. My mother had to have a meeting. They wanted to kick me out of school, but since I was in advanced classes and I had a 3.8 grade point average, they were like, we can't kick her out. Fast forward to high school, pretty much the same thing. I almost didn't graduate because I was absent so much. Depression and anxiety, but I was not diagnosed until like 21. So I was going through those things, not knowing what it is, not know, my mother didn't know she was sick. I think her illness had a lot to do with it from childhood to, because she was sick over a span of like 8 years from when I was 8 to 16. 3 days to live, multiple surgeries. She was mostly in the hospital. So I think that had a lot to play with, fear of the future and, oh, is someone going to die? Oh, is something going to happen? So fast forward, I wasn't diagnosed to 21. They diagnosed me with major depressive disorder, generalized anxiety, then bipolar. I was going through counseling. And the reason I sought help was because I couldn't work or go to school. And I told my supervisor at the time, and she said, well, sounds like you're depressed. And I didn't believe it because, like you say, I had physical symptoms. I'll have the headaches every day. I'll have the body aches. So I was like, well, it must be something physical. Went to the doctor, nothing physical. So as far as my blood work and stuff. So I said, well, let's try mental health. And sure enough, so they put me on, they tried all types of medicines over the years. They got like the Prozac, it got me to a point where, I wasn't bad as I was, but I was still suffering from the depression. Fast forward, so I stopped taking it for 2 years from 2008 to 2020. And I started, during that time, I started spiraling. And I was like, I know I was becoming a danger to myself. So I had to get back in care. I was put on a antidepressant, mood state, but I still wasn't there. I still was like depressed. Like most of the time I've been suffering with this most of my life. Like I feel like it controlled me to where I couldn't do what I wanted to do because I'm in the bed or, I'm too tired, like exhausted. So fast forward 2021, I was still really deep depressed, but I was taking medicine. So I'm thinking, this is the end, this is as good as I'm gonna get. My sister passed away. I was in Tennessee and I was already not, oh God.
It's okay. It's okay.
I already wasn't doing well. I already was having not so healthy thoughts or, barely can get out of bed, struggling to go to work, struggling. I went to Tennessee by myself, needed to get out of Florida. And I'm glad I made that decision. But so she passed away and after she passed away, like 2 days later, I know it wasn't healthy for me to be in Tennessee by myself. So I got up, I started packing and I'm like, I have to go with my family because I knew I wasn't safe, So, fast forward, I met Miss Tembo in 2022. I was desperate. I was going through, I get to where I'm so depressed to where I become a danger. And I know, and people don't, like Taylor said, it's such a stigma to where, and I talk to people see me as so strong and I got a bachelor's degree in psychology. And when I talk to them, it's my passion too. And I tell them, hey, I suffer from depression. It's like they don't believe it. It's like they, you know, because they see me as such a strong person, and you know, but I was waking up angry every day, and not only because my sister passed away, because this is a symptom, like waking up irritated every day, to where I was at a breaking point, to where that alone sent me into a depression, just being irritated all day, every day. And I was depressed. I was desperate. I was like, I have to see somebody that can get this right. Mm-hmm. I know, I tried the counseling and the medication. When I was first diagnosed, I had the racing thoughts, and I walk around like a zombie, and it was just bad. And I feel like the counseling and the medicine helped me open my Bible. I wasn't able to focus long enough to, read the Bible. So that was healing for me, opening my Bible, but I needed that medicine. And, so when I met Miss Tembo, I said, well, one time, when I was in my 20s, I was diagnosed with bipolar, but I didn't believe it because I'm, mostly depressed, and then all of a sudden after 2 weeks, I'll have a day, or, 3 days, I'll have 3 weeks, a month, 2 months, I'll have a day where I feel normal. I feel energetic. I want to get out and do stuff. And she was like, well, I wish, I knew who diagnosed you, because you are bipolar 1. She explained it to me. Now, I have a bachelor's in psychology. I've been working in mental health 7 years, but the textbook description, it doesn't, it gives you the symptoms, manic episode, but it doesn't really explain it in a way that I need. So she explained it, from you going from depressed 2-3 weeks, or, and then all of a sudden, having a day where you got energy, that in itself is a mood swing. So my normal, because I'm always depressed, is a mood swing. So I don't go, it's bipolar 1. So, right. So I don't go into manic, like the full manic. It's called hypomania, right? Mm-hmm. So it's not the full manic. But it feels normal to me. It's like a regular person that has energy. Mm-hmm. Since I'm always tired, that's what a regular person would call normal. Mm-hmm. So it made me think, out of 15 years, I've been struggling with this and wanting to get help, seeking help. And she was able to kind of pinpoint and put me on a regimen that works for me. And now I can get up and, do, because before, on the outside, I'll, joke and laugh and fun, but in the inside, I'm suffering. Mm-hmm. And I know I told Miss Tembo, during the time that, in my 20s, where I was at my breakup, but and even after, like, I knew I couldn't put my mother, suicide wasn't an option, because I'm not gonna put my mother to do that. She's already been through enough. She almost died. So I would come up with a way, okay, maybe I'll just run my car into a tree, make it look like an accident, so that people won't say, oh, she took her life. So how can I make it look like an accident? So finally, I'm to a place where, I feel, and it's a life journey. It's a journey. I had to learn how to adjust my life to what works for me. Going into large crowds, that doesn't work for me, so I stopped letting people force me to be someone that I'm not. Oh, why don't you do this? Well, I don't want to do it. So I had to learn how that's important, having to learn what works for me. Like the group, I was diagnosed with social anxiety also. Like the group counseling didn't work for me. One-on-one counseling worked for me. And I think, like, even with my eating, I know I stress eat. That makes me happy. So I had to realize, when I was a substance abuse counselor, I couldn't judge someone who smoked marijuana or something to cope with their emotional pain, because to cope with my emotional pain is food. So how can I judge you? So is that not a drug? Anything in too much can be a drug. So, a long story short, it has been a journey. I had to learn how to control my mental health and not let it control me. I tell everyone that, and I am in the field. I'm transitioning, into like medical billing and coding or something. I'm in school, but I did want to touch on how important it is to seek help. I think, like Leah said, medicine is not for everyone, but if you need it, like myself, I tried to kind of, oh, I don't want medicine to control me. And I was diagnosed with high blood pressure at 16. So I have to take that for my blood pressure. So why not take mental health medicine? But when I did stop, that's when taking my medicine, that's when, like I say, I have to take medicine basically at this point. There's no other option, because I refuse to be a person 70, 80 years old. Oh, I'm still, living in misery. I was miserable, living in misery, saying that, oh, I've been through this all my life, and, not able to live, and saying, it's mental health. I just refuse, because I want to have a life. I feel like it already, contributed to me not being able to be the person I want to be, as far as, I wanted to go for my master's. I wanted to do this. I wanted to do that. I have these dreams, but physically and emotionally, I couldn't do it. I'm in the bed, depressed. I'm, walking around like a zombie. So, and Miss Tembo can tell you, I get down on myself a lot about that, because I'm 36 years old and I'm not where I want to be in life. But I do try to commend myself for being, to taking the step to getting help.
Absolutely.
So
crucial point here, Miss Smith, it is important to seek help. Everybody watching, whether you're going to watch this after it's recorded, the week, 2 months, 3 months from now, the purpose we're doing this, and I'm very grateful on behalf of Alan for what Mutinta has done by bringing Leah, Taylor, and Miss Chantrell here. There, you see, and Mutinta, I'm texting with a friend here, and this friend is telling me, why do we find it so difficult to talk about this? Like the way Miss Chantrell is doing and Taylor. A lot of us, if I can put my friend Alan here on the spot, Alan, before you said what you said on this show about not visiting mom's grave, did you ever say that to anybody?
No, absolutely not. Remember, I'm a pastor. I'm a community leader. I'm a husband and a father. I'm an older brother.
We're all carrying all these things. And one thing I want Mutinta to address, you and I talked about this during the week. And Ms. Chantrell has mentioned here, she was diagnosed with social anxiety. And I'm saying to myself, when you're diagnosed with something, which means it's an issue.
Yeah.
So how do I know I have social anxiety?
Oh, that's a good question. Remember in the beginning how I said we are our DNA and we are our environment. Our environment can actually impact us in a way that can change our DNA. And now we start to pass these things to our children. It's called epigenetics. Now, social anxiety comes from an environment where it's very strict. In layman terms, that's how I'm going to put it. Very strict, rigid. You got to do this. So we'll call this girl, that's a case study. We'll call this girl Sarita. And Sarita is 2, sent to live with the grandmother in the village. The mom has to go to college. The grandmom and granddad loving and, just embracing her. And she's meeting all the milestones that she needs to. At 3, Oh no, at 5, the granddad dies. And this is her first love. This is her protector. He's taught, he's respected in the community. He dies. And she doesn't process the death of the granddad, the father figure. And then the grandma has to fill in that. Well, she lives in the village. In their tradition, the uncle takes over the village. The uncle whom she doesn't know, that's the nephew to the deceased. In the Tonga tradition, comes in and takes over. He brings in his dozen children. Now Sarita is a stranger in her own home. And Sarita is of mixed tribes. She's not accepted. She doesn't have a say. In the Tonga, they property grab, right? They take everything. And now her and her grandmother have to figure out, okay, how are we going to survive? And the majority of the village say you don't belong because you are not a pure whatever tribe. You have no say. In her mind, she's like, this is my village. This is my granddad. He was my first love. He put me on the shoulders and we went to bite. This is my village. And they're like, no, it's not. What is your last name? She's trying to figure out.
Tembo in Southern Province.
So Sarita right now is feeling she doesn't belong. Okay. She's criticized. She's outspoken. She has anger because she's experiencing the sister wives, the grandmothers, being ill-treated and pushed away from the village. This is a case study. So I'm talking about those things that can affect you and actually have social anxiety. Ill-treated, she sees them cry themselves to death. When the uncles who are rich, they come to the village, those people are acting like everything is kosher. The suffering continues. And there's anger. There's a black mamba growing in Sarita.
Yeah.
Okay. And she doesn't belong. She's not accepted. And the grandmother said, study hard. You're going to go to school. You're going to don't worry if they don't share this. And there's so much dysfunction, the judgment. And at some point, Sarita passes, goes to secondary, goes to live with the mother. The mother is married. They have a whole structure. She is organized. She wants things done a certain way. And Sarita is like, I'm a free-range chicken in the village. Why are you putting me in structure?
Yeah.
Don't give me structure. And she's like, you are a woman. Didn't your grandmother teach you this? And you're supposed to be that. And that's well and okay if she grew up in that environment. You just took Sarita from a different setting. You just put her in an environment where the structure is stringent. You have to get up at 6 o'clock and then, why are you still sleeping? Get up. You're supposed to sweep. Kapange mbaula, make tea, sweep, do this. And Sarita is just like disoriented. At this point, she's thinking, this lady doesn't like me. And at some point, while she transitioned in the city, she was accustomed to being number 1, number 2, number 3. She's in the city. She doesn't speak English. She doesn't speak Nyanja. And that is the language of instruction. And she fails, like second last in class. And the stepdad said, Sarita, you are down. Not smart. And Sarita can't defend herself like, I actually am smart. I just didn't speak the language. So Sarita has to prove herself, right? She's trying to belong. She goes to secondary school. She doesn't speak English. And she looks nice and she fits in like she's from the city. And the village girls are like, go hang out with the yo. You look fancy. You don't belong with the village girls. Like, but Sarita, again, doesn't belong. She's frantic. She wants to belong. She wants to be loved. She's never been embraced by her dad. She's never been embraced by, and whenever she's had that structure, it's been rigid. She's been criticized. She's been said to be down. And she's probably just a normal teenager doing naughty things. But there are structures that are keeping her in line, and she feels misunderstood when she grows up. Now, Sarita, this is from, I'm sure, Aliyah, you use, I like Eric Erickson is developmental stages. Yes. So this is happening between the age of 9 and 11. Okay, that's when she moves, and then from 13 to 20. Big milestones there. She's supposed to feel either industrious versus inferior. The next stage is isolation versus
mistrust, generativity. No, if not mistaken.
all right. Anyway, she's trying to find her identity.
Yes.
Are we there? I'm not
Yes.
sure.
I just put you by yourself.
All right. So she's trying to find her identity, right?
With confusion.
Yes. She's isolation.
Yes.
This is fidelity. In the previous stage, she's supposed to be very
the teen years, the confusion versus the identity.
Yes. She doesn't know who she is because she hasn't belonged. Everywhere she's been, you don't belong, you don't belong. Or you're this, or you are thou. Or you can't speak English, you're not. Oh, you look fancy, so you must be with the rich. You look this. There's confusion. So if you're looking at it from Erickson, there's 2 milestones there. There's disruption, and it's almost trauma for her. Yeah. She doesn't fit in. She doesn't feel like she's good enough. She doesn't feel industrious. The previous stage, this is industrious, inferiority versus, she doesn't feel like that. She's not sure if she takes initiative, she will not be criticized. Fast forward, Sarita is whatever, in grad school, and she has to present in front of a class. How do you think Sarita will do when all the eyes are on her?
Not so great. All those negative core beliefs are kicking in at that time.
I promise you, Miss Chantrell doesn't want to be in public. She doesn't want to be looked at. Don't come close to me. And she feels like the eyes are judging her. Because there was trauma in those developmental stages. And I know I went through it a lot. You can pull it up, look at Erik Erickson's developmental stages. Taylor, both of you actually, Taylor and Miss Chantrell, your psychology, look at that. And you will see if trauma happens at a certain milestone, you will see the dysfunction in adulthood. So this is coming from environments that are rigid, where there is dysfunction, where someone doesn't feel supported so that they can be industrious and be able to take initiative. She didn't go to school. She didn't fit in school. She felt she had an incident. You can talk about it, where she ends up being expelled. I won't say the details unless you want to say the details. She gets expelled from there. And then at home, what do you think they are thinking? You don't listen. You're starting trouble. She feels misunderstood. She's not going to be confident. So social anxiety, pretty much, you will have visceral reactions of heart palpitations and can't speak and tremble. Yeah, you can tremble. It's a sympathetic nervous reaction, fight or flight. That is what social anxiety. I wanted to give you a scenario because sometimes when you say social anxiety, it's like almost like a roof, right? Put someone in a situation and environment where they come from.
You've done a good job. You've done a good job, and it's relatable. Actually, it's very relatable. I wanted to say something, Leah.
Yeah, it's so important too. So you guys have mentioned a lot of things, and a lot of it is challenging some of those judgments that we place on ourselves, because a lot of times we're having all these negative internal thoughts because of childhood trauma, a lot of negative core beliefs. And so a lot of times we have that imposter syndrome, or we feel like we're not good enough, and we're scared that someone in that crowd is going to see just how not good enough we are. Meanwhile, that person is thinking about pizza or whatever other things that might be going on. So it's so important to be able to challenge some of those things, challenge those thoughts, and be able to take the judgment off yourself. And judgment goes a long way, even with just, why can't we speak about these things? Because we're always so scared that someone's going to see us and put us down or tell us we're not good enough.
Yeah. Okay, let's wrap this up. 2 questions to wrap it up. Okay, Matilda says that's a great example of childhood trauma. And it refers to our earlier question. Nelly says this is great information, much needed. Okay, the purpose of our discussion, the theme is dealing with grief, coping with grief and trauma during this holiday season, and a lot of things happen. There is something that I have called, let me put it up here. Let's deal with this. Okay, the firsts. We are in the holiday season. I shared with Mutinta that a dear friend, a well-known national leader back home, lost his son like a month ago. And his birthday just came up. And he posted something, Leah, Taylor, Mishantrell, and he said, those that have been through this told me about the firsts. That's where I got that from. So he was having his birthday for the first time without his son, who had just passed away a few weeks ago. So I'm using this, the first. I know a lot of people are close to me who are experiencing this. One of them is watching this, and he's commented a lot. But his dad just passed away. He just came back from home to see his mom, who's a widow now. So the firsts. The question about the firsts. A lot of people are going to go through this Christmas without a loved one who has passed away. Taylor is with us here. She's one of those. She's going to go through this holiday season. She's going through this holiday season without mom. How do we honor the deceased loved ones and still have an enjoyable time?
So there's a big part of that when it comes to the first. I think it's important to acknowledge that you don't have to be happy. You don't have to celebrate a particular way, because I think a lot of times people have these expectations of, oh, it's supposed to be this way and I have to do this and I have to do that. And the truth is you don't have to do anything. Honor yourself and your body first, right? If you're noticing that that day you just feel really, really sad and you just want to sit in the bed and cry all day, that is okay. If you decide you want to be around family and friends, that is equally okay. If we're working on something in a session, I'm going to say, well, let's plan ahead for both scenarios. Let's plan ahead for what you will do if you do decide to go out and be around people. And let's plan ahead for if you need an exit strategy or just need to be in the house. I had a client, this was before I got my master's, but I was doing social work. And I had a client, I was working in homeless shelters in New York City. I had a client that 1 year during Christmas or around the holidays, he got into a car accident and he killed his whole family, his
wow.
and his wife. And so every year around the holidays, he would try to overdose on drugs to get by, right? And that always stayed with me. It's important for people to know, reach out for more help and get resources if you should need that, because these things will come up. And it's not just the first holiday. Yes, the first will be the initial bump, but every single year on that anniversary, feelings and things might come up because your body keeps score. Your body remembers these things. So plan accordingly. Honoring the dead. I always tell people sometimes it's good to write a letter or call and send a voicemail, right? If they still have that number and you can hear that, it's okay to go and talk to them, like if they're still there. What would you tell your mom? You know, I'm sorry for everyone's loss, but what are the things that you would tell your mom? What would she say back to you? If you want to write it in letter form or pretend that you're on the phone call or you're just having a conversation, allow yourself to do that. That does not make you crazy, right? You're not hearing anything or anything because of that.
Interesting that you say that. The other day, there's a way when you do things to the phone and it brings up, I was searching for somebody's name and I just put the first letter and it brought up the name of somebody who died 2 years ago. I decided to click on that conversation and it brought up the last messages that I exchanged with that person. I sat there for like 15, 20 minutes just looking at those messages. And I said to myself, did I miss anything in here? Because it wasn't long after that the person died. And I said to myself, did I miss anything in here? Alan, I'm trying to look through that, like the way we do with the scriptures. What was this saying to the people then? What is this saying to me? And those of us who are theological students, you go into the languages. Then how was it said in the original language?
in the language.
I'm just trying to process the messages. I said, did I miss anything in here? You know? And I'm telling you, Miss Chantrell, I said to I couldn't believe I had that moment. I just said to myself, did I miss anything? Because the point is, it wasn't long after that communication, the person died. So I was saying to myself, I said, did I miss anything here? You know?
Yeah.
Okay, we can go on for 3 hours.
We can absolutely.
And Taylor, how do you plan on honoring your mom this week? Did you have that in mind?
Yeah, I wanted to touch on that because when she passed, it was October 23rd and her birthday was October 28th. So I like immediately went through a first. And my family wanted to get together and do a whole thing, and I had to sit back and say no, like I can't do anything that day. You know, I can't even like get out of bed that day because I was just thinking about her. And so for the holidays, so far for Thanksgiving and all of that we have, I made the things she would make for the holidays. I made the same dishes that she would make because she gave me all the recipes for everything. And for Christmas, I'm planning to do the same thing and just probably go to her house because her house is in my name now. So I'm planning to go to her house and just spend time there, you know, with just the feeling of her still being there. You know, all of her stuff is still there. We haven't gone through that much stuff yet because we've all been trying to process what happened. But I'm just going to try to honor her and just remember that she would want me to enjoy the holiday. She would of course want to spend it with me, but I feel like her spirit is still there. I feel like she's always with me anyway. So I'm trying to just live for her, you know. That's what I plan to do.
A lot of times when people die, right, and we have the funerals and things like that, we say a celebration of life, right? And so in some ways you're able to still honor by celebrating those things, celebrating that person's life, what they meant to you, how they impacted you, things like that. And it's okay to do that. And Taylor, allow yourself to feel whatever comes up for you because none of it is wrong. That grief process, we tend to think that it's linear, like we have to go, oh, you're going to feel this and then anger and depression. It's not like that. Some days you'll be just fine. And then some days you'll sneeze and start crying. Some days you'll be in a place where you're really, really angry. And other days you'll feel like the depression all over again. All of it is okay and all of this is acceptable. Please don't feel like you're broken or something's wrong with you.
Absolutely. What about you, Miss Cantrell? How will you honor your sister this coming holiday?
Well, we all get together, you know, like we used to. We all do like a potluck and we bring dishes and we get together and eat. We don't really talk about her much because she left behind her 13-year-old daughter. And we don't want her to, you know, we don't want to talk about her in front of her because we know she's not ready. And honestly, you know, it's just been hard because she was the life of the party. We all were close. My mom has 7 kids and I'm the baby. So, you know, it's just been hard to kind of, you know, talk about her in front of everybody because everybody's, you know, kind of, you know, let's not talk about it because we don't want to. She has 2 kids, my sister, so because we don't want to, you know, them to have traumatize them by talking about her and stuff. But we still get together. It's not the same. I'm going to be honest. And I had to accept that it's not going to be the same without her. Every holiday, you know, I think about it, how like the atmosphere is not the same, you know, but we still, you know, come together in her honor and, you know, love on each other and, you know, take care of my nephew and my niece. And that's all we can do is kind of, you know, still be a family and support each other. I do want to say that, like, encourage everyone to get for grieving. get the best help that works for you, whether it's a group. Some people are extroverts, or whether it's counseling, whether it's the medicine. I do want to touch on this. I know we got to go. When she passed away, like even now, if I wasn't on my medicine, to be quite honest, I probably wouldn't be here. Just because I already suffered. I'm sorry.
That's
I
okay.
already suffered. And like even before she passed, it was like I didn't see a purpose of living. I mean, before, I got back on the medicine and counseling. I was counseling with Leah. Leah was counseling me. And I feel like the medicine helps me be able to, get out of bed and help with my niece and focus and live my life and, have her live, do things that she wanted to do, go back to school. And she had a master's degree and, do all this stuff. So I feel like that was my way of getting help. The medicine, changing my medicine, having Miss Tembo put me on a regimen, because I was still, when I came to her, I was taking medicine, but I was still deep in depression and not safe for myself. So I feel like that was important to get that help and talk to a counselor and kind of get that support from family. That is important. So get the help. My message is get the help that works for you, and because I know what works for me, so.
If I can just jump in. So yeah, I do think it's important sometimes having those two things in conjunction. And also, I don't want you guys to necessarily feel scared of group therapy. I know sometimes it can feel like, oh, I'm going into this room with these bunch of strangers and things like that. But it's so essential because sometimes there are people that are also going through something similar. And so one thing I love about groups is that people are learning from each other. It's not often the counselor doing a lot of the work. It's the group members, and it's important for the counselor to make sure it's the right chemistry. So sometimes your group could just be 3 people, or your group can just be 2 people, and that's okay too. And Chantal, to your point, absolutely. Sometimes medication helps calm that amygdala down just enough so that we can let the coping skills kick in. It starts to work, and it's okay to do both and navigate that. Thank you so much for sharing your story with us.
Absolutely, absolutely. What stood out to me with Chantal, I think for the first time she got me. They know like I'm jovial. I'm positive. Like we're gonna get this. But she got me one visit when she said, "I wish my sister had met you because she would be here today."
Wow.
That got me. Like if she had the hope that I'm getting, she would be here today. I was just like, okay, she's bargaining, but I hear her. I mean,
one of the major highlights, the feedback coming in about what we have done today, is what Chantal and Taylor have done. Major. This is major. Okay, this is major. And when we started the show, we made a promise. That we're going to deal with everything and cover. Okay, I said we're going to end. We're not going to end until we answer this question. We promised that we're going to cover everything. We're not going anywhere until we cover this. All right? There is a question there. Talk about talking to deceased loved ones, a Christian perspective and from a therapy perspective.
To be honest, I don't think those two things have to be so separate. I know a lot of times we're like, oh, Christian counseling versus maybe secular counseling. But those two things don't have to be. To be honest, they're synonymous.
Sorry to cut you short, Leah. I don't even know why we do those things. Secular, Christian. Shouldn't counseling just be counseling?
Yes, correct.
Isn't help just help?
Yes.
Is there a Christian help and secular help?
What's crazy is that we cherry pick.
Now I'm starting
when to put the label on. We cherry pick when to put the label on. Sometimes we're just human. We're going as a group. Then all of a sudden, oh no! But this aspect is a Christian and non-Christian. But this other one, we are all just human. It's ridiculous.
Yeah. Go ahead, Leah.
A lot of times what people don't really realize is most of your counselors already come from a spiritual background anyways, right? They just don't necessarily carry the title of, Christian per se, or some people are just more spiritual. At the end of the day, I think that the techniques are still the same, right?
Yeah.
And therapy or counseling will say, oh, this is a chair technique. And if somebody's in office, we'll have them sit and pretend that their loved one is in that chair and let them say whatever they need to say. From a Christian perspective, that might be looking like, oh, well, we're praying, or, we're going through the Bible for this or that. So there really doesn't have to be too much of a difference. And the most layman's terms is just that the degree looks a little bit different, right? Your master's program mine might be more focused on other general pieces, whereas the Christian counselor might take some more theological courses, to add to the degree, right? So that's really where that separation is. But outside of that, every counselor is there to have that unconditional positive regard, to have that understanding and provide you with those tools that you need to do. But I agree, we have to get rid of this.
Leah, I'm a theological student. The psychology I studied, the class I took, there was nothing Christian in it. It was just psychology. The philosophy, Mr. Antrell, that I studied, Alan, you're bearing me witness here. Was that philosophy class?
Yeah.
Did it have any scriptures in it? It was just a general philosophy class. So I don't know where this was. Matilda, stop asking difficult questions. We need to go. We need to go. Let's talk about, and we said we were going to conclude with this, what help is available out there. And like I said, that's a reason I've kept Mutinta and Leah's practice website here throughout the show, so that you know how to reach out to them. Those of you who are afraid, you may not be able to express certain things in English. Mutinta speaks Bemba, she speaks Nyanja, she speaks Tonga. So you can express yourself in Tonga to her. You know these languages until I don't know what anxiety is in Tonga. We'll find out.
I think actually that's a good point, because that's a challenge. There are no words in Zambia for depression or anxiety. They're not. So you really have to probe. And that's a good point, because I consider culture. I have treated someone from Northeast Africa with some, Arabic background, and I had to consider their culture before they came. I had to read, what do they believe in? Do they believe, which is witchcraft here attached to it?
Like Matilda said, talking to the dead. Yeah?
Absolutely. And the understanding is the spirit of her husband was sent to her, and that's whom she was talking to. So I had to find out, is this something that is in her culture and whatever. So in this case, it doesn't matter where it's coming from. My goal is to manage the voices that they're hearing, whether they are culturally related, religiously related. I see the cross or Mother of Jesus and I have a Sandaria or whatever. I have to treat the symptoms. Are they having auditory hallucinations? Are they going to harm themselves? Are the voices says go jump on the brick? I have to treat the symptoms, but I will consider whether they're religious, their cultural background. I will consider it. I will not dismiss it, and I will respect it.
Very much so. I think it's so, and this is why representation matters, because if you go to somebody and you say, oh, I feel like, for example, Taylor, your mom is around you, right? It's so important for clinicians to have someone that you can understand that, hey, that doesn't automatically mean that somebody is psychotic or that they're hearing things, right? If somebody comes in and says, I'm hearing voices, I'm going to ask, okay, you're hearing all this. Are they command? Are they telling you things? What does it sound like? Is it your inner thoughts that are telling you these things? Or is it that you actually hear an actual sound and nobody's there when you look around? A lot of it, while the words don't translate, the feeling and the symptoms always translate. And it's so important to not make people feel weird or crazy or any of those things, because we live in such a big world. I also like clients educate me on certain things, right? If I'm dealing with someone that's dealing with a certain substance abuse, a certain way of like, hey, teach me about that, right? Because you know you better than anybody else. And then I'm going to meet you where you're at based on the things that I know. And together it's a partnership. We're working on healing and getting to where we need to get to.
Absolutely.
Yeah.
So how do you get to Leah? If you see me first, Leah has her own practice, which is Serenity, and we've partnered. And if I see that you do need the therapy, I refer to her. I truly believe in her services. I feel like we need each other. I can take a patient to 70% most of the times. Sometimes they need that therapy to get to 100. So we work as a partnership. Other organization I love, NAMI. Leah, you can look up what NAMI stands for, but this is a please, I don't think I can cite it correctly, but this is a non-government organization. It's free of charge, no matter what disorder that you have. No matter what you're going through, be it PTSD, be it depression, even if you are grieving, there are groups there that you can be part of. Every state has a NAMI chapter. So
okay, can you just type NAMI in the chat so that
National Alliance on Mental Illness. I'll go ahead and send their website in the chat.
Absolutely. So they're accessible. If you have someone diagnosed with autism, special needs, you will have those groups that will help, you can join and they can help you. Workers, HR, find out tomorrow, Monday, find out if they have an EAP, do you take EAP?
EAP program.
Programs. These are offered to most organizations offer these. They're accessible to everyone. They'll offer, each company have some, I think standard is 5, right? 5 sessions.
3 to 6 sessions. Well, I know Disney does 10, so okay, like about 3 to 10 sessions, but find out the number. Yeah,
absolutely. So you can get free therapy from the church. Find out from your EHR if they offer that. Most companies do. It does cost money. Like I said, there's only 2% of us that are board certified. If you're looking for a board certified provider, so it costs money to see us. An evaluation maybe the average is $350. So make sure you use those resources, awarded to you from your employers. They are free. They are offered to you. Take advantage of those therapy services. If you come to me, I'll give you an eval. And for therapy to go use your EPA, you'll go see Leah.
Excellent. Okay. That's a website there which is like in every state. It has been mentioned. And here's a comment also from Dr. Naomi. She's a much needed discussion, well timed, because this festive season, suicide ideation cases at their highest. I'm equally navigating a Christmas without my mother. Okay. Very important. Like I said, we are all dealing with things. This is our mother. She's a leader in the community. She's a chaplain, a PhD. And ladies and gentlemen, we want to thank everybody for your time. Let me put back Mutinta and Leah's practice here. You can get in touch with them. Like we said, these things cost money. We wanted to just bring this information to you and hope you have a blessed and Merry Christmas. And to the team, oh my goodness, Miss Smith, amazing. Thank you for taking the time. Thank you for taking the time. And Taylor, you have no idea what this has done to just this whole perspective. We appreciate you being here.
I'm so happy to hear that. Thank you.
Thank you.
And my newly added member to the family, Miss Leah. I still haven't decided what name to give you, a Zambian name.
She looks like she's from either Luapula or Chinsali.
That's his tribe. You see how these people always want to keep people in their tribe? Why can't I say she looks like she comes from my village?
You mix of both.
Selfishness.
Guys, for having me.
Thank you, Leah, for taking the time. And everybody, I just want you to know that Mutinta and her team are available for help. She said this to Alan and I. She's willing to help our community. Okay, she's willing. And what has happened here today, she's responsible. She made this happen. She did a lot of work, and she thought that it will be helpful if we have some real life testimonials and people speak about their life experiences. All right. Alan, my good friend, let's keep doing this.
Yes.
Very helpful to the community, all of us. I'll tell you this, I've got my therapy by going through this.
Oh yeah, I got a lot of therapy.
I have
a lot of therapy.
Leah Mutinta has put me in that situation where anything that happens to me now, I'm like, oh, okay.
Yeah.
I'm telling you, like that incident, that experience, Miss Smith, I had on my phone. I'm like, I'm looking at this phone, I'm looking at the messages, and I'm like, wow, what happened here? You know, things like that. So that's what these kind of experiences are.
You know, Pastor Nathan, before you go, I put a bag in all of you, everyone here's ears. The other aspect that we didn't touch on is how do you deal, like someone in, let's say, Taylor, your position, now when it comes to romance and any kind of romantic relationships, and somebody that hasn't experienced yours, what does that even look like? So all those dynamics of life, she talked about professionally, at work, what they face. What about, I gotta get love too.
Yeah. We can schedule another one where we can talk about those things. That's it.
I would say because Mutinta knows I love psychodynamic therapy.
That's if Taylor will be willing to talk about her love life.
Of course.
That's up to her. Before Miss Chantrell wants to share something about resources as well. You wanted to say something?
Yeah, real quick, you know, because I was a mental health case manager, care coordinator, and substance abuse counselor. So I had to know about resources. So for those, you know, while I was getting mental health help before, you know, I had to take a leave from work, so I couldn't pay my bills. So there are organizations that help with rent, lights, phone bill, you know, utilities.
Yes.
So just, you know, type in where you're at, financial assistance, or even if it's you know, you lost your job or something like that. So there are community resources, you know, that will help if you need that while you're, you know, in treatment or. So I just want to let you all know that.
Great.
Excellent. Thank you so much. All right. Chantrell, Taylor, Leah, Mutinta, thank you so much. Please don't go away. Just stay in the background. We'll finish this. And everybody, we appreciate you for tuning in and taking the time to spend the weekend before Christmas with us. And we do trust that you have a wonderful Christmas, and take the courage and the time to celebrate the loved ones that you have lost. Celebrate them by giving them a good memory. Okay. Before we go, I want to give a good shout out to those that have just graduated yesterday and today, to my amazing niece, Natasha Silumbwe. Congratulations, BSN. We have a BSN in the family, yeah.
Welcome to the family.
Yes, okay. Mutinta says, welcome to the family.
Absolutely.
And also we want to say congratulations to my nephew, all right? Tokoza Miti is in the technology stuff. He just graduated this morning. I just got a picture, and he just graduated. Congratulations, Tokoza. And we shall be, let's see if we're going to have a party today or something like that. All right, everybody, have a great Christmas and enjoy your time. I'm working on doing a musical next weekend and see if we could just have something musical and enjoy some music and think about the importance of celebrating Christ. And everybody else, Merry Christmas, and we'll see you next time.
Zambia Blog Talk Radio.